Call the meeting to order of the Bay County Veterans Affairs Committee, Tuesday, May 19th at 3 p.m. in the Bay County Building, 4th floor. Roll call, please. Whoever's doing it.
Vanto, excused.
Tuesday.
Begic,
Here.
Creener, absent or excused. The new lady, absent. Conklin.
Here.
Eckstein. Here. Stewart, here. Matt Bieber.
Here.
And Mark Kazmarek.
Here.
And Andrew Turner.
Here. All right. Please rise for the Pledge of Allegiance and give me a minute to get up.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. We
Are you
have,
Karen, by the way? Jen.
Oh, yeah, we have some new members. We have one new
Was
member.
it Jen?
You come up here.
Come on up.
Come on out.
You do look familiar. I do recognize you from,
Yes, I think I know you.
I probably recognize you from work. How are you doing? So Jen is here.
Just in time for introductions. And Jen, we'll let you go first. If you could just tell what your military experience, I guess, was, and then what you're doing currently.
My name is Jen Kreiner, and I was a forklift operator. I was on active duty at Fort McClellan, Alabama. I joined the Army to see the world, and I went to Alabama. I was stationed at the U.S. Army MP School, and I mostly worked in the arms room and the chemical, like the nuclear, biological, and chemical. And I issued all of that equipment to the soldiers in the MP school. Then I went into ROTC, and I got out when I was a cadet and finished college instead of going back in the military. So I was in for 5 years.
Yep.
Now I'm a nurse practitioner who worked at the CMH in Genesee County for I don't know how many years, and then here in Bay County at Bayer Neck Behavioral Health for 11 years. And I've been at the Saginaw County CMH as the Chief of Health Services and Integrated Care for 4 years.
Thank you. I've been a PA for 50 years. I've worked with a lot of MPs and stuff. How about Tim Conklin?
I'm Tim Conklin. I was in the Navy, stationed at Pearl Harbor. I was a boiler tech, and I was also oil king, water king on the ship. I was a firefighter for 20 years, and I'm currently on the Honor Guard in Bay County and retired.
And we got Memorial Day coming up next
Big
Monday.
day, yeah.
Be busy.
Be a long day, yes.
Yeah, a lot of ceremonies. Thank you for giving us a quorum here. We have 7 on the board now, so we have five out of the 7, so we do have a quorum. Minutes from 3/17/26. Looking for, do you want to read them over? Whenever you're ready for a motion.
Motion to accept the minutes as published.
Second.
Yeah. Discussion? All those in favor say aye.
Aye.
Opposed, same sign, motion carries. We have citizens' input, and I brought my wife along, Margie, but she doesn't have any input, she said, so maybe next time. And then petitions and communications, I don't have any. Okay. Reports and resolutions, we have the Q1 statistics. I'll look those over and ask any questions if you want to. Somebody wants to highlight those, maybe?
I can certainly talk. So the first page is actually the emergency relief section and what we've spent for the first quarter of, 26, sorry. Trying to figure out what year we're in. And then based on, how much we've helped, what we've helped with, which you can see the total amounts there, and then what the things that we do regularly help with that people need. It'll come up later, but there's a copy of the policy included in your packages that explain what it is we give help for and assistance. They can get a food and gas card once a quarter, and then we pay a larger city bill or some other larger bill once per year. So then included on that is also our transportation. We do, currently 2 days a week, we pick up veterans at their home, take them usually to the Saginaw VA or a VA mandated appointment for them, and then we return them to their homes. The third one down there is county burials and markers. So we pay for, burials and markers, sorry. We pay for $300 for a wartime veteran and a spouse. For each of them, we pay $300 total, so $600 if they're alive. And it just kind of keeps track. We had 26 veterans, 8 spouses, 3 markers, and then because the requirement for the law is it has to be a wartime, so that's, you'll see there's no wartime. There are several that have come through that have not had wartime experience. And then any trust fund applications, which we have one that's currently been in process for several months now. And then the second part is the other part of the activities we do down there are claims to the VA. So that just kind of breaks down the different types of claims, how many we've done in the quarter, and by, wartime era, where they live, because we can assist them wherever they live if they don't want to use the service officer that's close to them. And we do this per quarter for the county, and then we also do it because we receive a grant from the Michigan Veterans Affairs Agency. We're required to report to them once a quarter as well.
Questions? I just see food is top of the list for expenditures. It's a common problem. A lot of I know being on the Salvation Army, we see a lot of people come through over there. And did you say what, twice a week you're driving right now?
Twice a week, Wednesdays and Thursdays.
Okay. Has there been any problem with people on Mondays or Tuesdays, or are they finding
We
rides?
find other rides, yeah.
Yeah,
There's the vet lift program. They're
Yeah.
able to take part in that most of the time, so it typically hasn't been too big of an issue.
yeah. They have the options then.
Still looking for drivers, though, if anybody ever wants to, somebody.
Yeah.
So new drivers?
We could always. But we're grateful for what we have, and it's been working good.
Yes, if you're retired, it's a nice job. I did it for a couple of years. It's interesting, you get to talk to the veterans and, get their story and take them up to Saginaw, hang out there for a little while. So, yeah, sign up.
Yeah, my neighbor's a driver.
Yeah. Easy job.
Who's your neighbor?
Jesse?
Oh,
Oh, yeah, he's the newest one.
Yeah,
Great.
he was talking to me about it.
Awesome.
Thank you.
yes, sir, buddy.
The trust fund, I was wondering about that. We used to have the trust fund people, there's a secretary here, now it's not in Lansing. I've heard it's, they have to make phone calls and go through a process, so I don't know if that's stopping people or there just isn't as much need.
So like the biggest issue is, and this is something we spoke to the folks from MVA up at our yearly conference. They were there and we were able to actually talk with them. The reality is they are coming back around and retraining everybody because they're realizing that so many of us are new to their program.
Yeah.
And there's a lack of, their policies have kind of shifted some, so it's hard to say exactly what, like we aren't having a lot of people even asking about it because generally most of the folks that are asking for emergency assistance are needing something very quickly, and that is not a quick program. I mean, we've got one that's been sitting about 5 months now at the state level, just sitting there, and we can't really get a heads or tails of why it's not moving forward. But for the most part, we've been able to handle most emergency requests locally to where we haven't even had to turn to the Veterans Trust Fund so far.
Yeah. I remember we had the secretary here so she could answer the questions. She had her keyboard, or her old typewriter, I remember, the old style.
And
She had the answers.
they came up with an online software, but provided zero training on how to use their online software. So it's been, he's had the brunt of that, trying to figure out what do they want, where does it go, where does stuff, and then getting a response back is, and the one lady was out sick, whatever
Right.
has been there. What we'd asked, did we annoy somebody that you don't want to talk to us? We're just trying to get a status on an issue.
Yeah. Yeah, been an issue. Any other questions? I think a lot of veterans don't know about, burial allowances and some of the other things that we have for them, so hopefully get the word out. I know you've been to some of the activities, like the meal that we had. You're there, and you try to make some of the other events too. And otherwise, motion to receive would be in order.
Make a motion to receive the Veterans Committee report, Service Officer Committee report.
Discussion, questions? All those in favor say aye.
Aye.
Same sign, motion carries.
So, and we'll be happy to explain any of that if you have any questions. We'll be happy to explain, jumping into, we've got numerous programs going on that kind of go all over, so we're happy to talk about that at any point.
I'm sorry, did you say it was $300, Mark?
$300 per, yes.
That's if the income threshold too, not just everybody gets that.
Yeah, if any of you get questions from veterans, send them first floor. See the crew down there, they can answer the questions that if you have veterans talking to you about what's available. Old business, 2025 emergency relief policy update.
So in 2025, there was a change on the food and gas card program that any county veteran or spouse that takes part in that, whether it's one quarter or every quarter of 2 consecutive years, on the third consecutive year, they could no longer take part in the food and gas card program. Because a lot of the folks that are in that program have been in it for quite a while, we wanted to make sure that they were informed that that change did happen so that it would start affecting them come 2027, because that would really be the first time that 2 consecutive years would have passed after that new change had passed. So we've been having basically anybody that's coming in for food and gas cards is signing this document so they understand what the program change that happened and how it may affect them. But we're trying to stay on top of it to make sure they're very clear that if they've been using the food and gas card program for 2 consecutive years, that in 2027 they would not have access to that. So far, I haven't had any kind of complaints about it. Everybody's been very understanding, and so.
And that decision was made by the committee in 2025. I'd have to look up the exact motion number. But it was the committee that had come up with that and said, hey, let's change. And that's why we also included a copy of the policy. And you can see the red changes that were the last ones, what were just made.
What kind of numbers are we looking at that are going to max out at the 2-year point? That were 25, 26? What kind of numbers are we looking at that'll max out that will be eligible?
About 30 a quarter,
30?
approximately. 30 per quarter, so that 120 a year, so at some point you'll see the number dip.
Any other questions? Otherwise, I guess we maybe should have a motion to receive and accept the emergency relief policy updates. Looking for a motion? Yep.
A second?
Any other discussion or questions? Thanks for doing that. All those in favor say aye.
Aye.
Opposed, same sign, motion carries. We have new business. We have a new burial form. Draft version, looks like.
So what we noticed is there was about 3 or 4 different burial forms floating around depending on the funeral home that we're sending them over. They were all outdated. They all had conflicting information on them. And so we were going back through, and that's why these are still marked draft. This has not gone through corporate counsel yet, but they will make sure she gets past this also. But we wanted to make sure you guys had a chance to take a look at the changes. it's all the same information, just more of an updated version of it. But we also kind of touched on the wartime service dates, which the prior forms never showed, they just talked about. And we also made it very clear that the DD 214 has got to be required because there's just no other way for us to confirm the service would fall under what the law requires. So we're just trying to make it a little bit easier, kind of simplify it, both for the funeral home to where they, and for the veterans' families. It's a tough time when they have to do this regardless, but we want to make sure that they're getting the best information possible.
And that's available at the clerk's office, by the way. If somebody has lost their DD 214 and they need one, if you stop at the clerk's office, they can usually get you one pretty quick.
And if they don't have it, come to us. We can get it either through the state or we have to do an archive search for it.
Yeah.
So the other page, the other one we had was like 4 pages long. We sometimes got half the pages. Sometimes we got, 1 page of one and 1 page of another. So we're always trying to track down another. And then, as he said, they were old. We've got at least 3 different versions floating around someplace. So we're just trying to get it to be a better one for the funeral home, because the funeral homes are the ones who generally do these, and then they send to us, and then we reimburse back to them. But it just hopefully trying to make the process a little bit smoother and making sure we're all on the same page for the burial. So.
Then the markers are available. I know for Veterans Day or Memorial Day, when you're putting out the flags, it's good to have that marker that you're a veteran. So make sure you get that, that's covered or paid for. So get that marker on your grave.
And it was kind of important that we put that Andrew's the one who did all this, that we had the service dates on there. If you look at the statistic report from earlier, we're getting more and more where they're not qualified to get. So this operates under the law, Public Act 214 of 1899, that says, well, actually, there's another one that covers this, but it's part of 1899 says for emergency relief, they have to be a wartime person. So we're getting ones for various periods of time when there was not obviously a declared wartime. So we're having to, then we have to go back to the funeral home and say, hey, this one isn't qualified. We keep track, which is why you'll see it says we're 8 ineligible in the last quarter alone. And there's probably going to be more than that this quarter.
I know a friend of mine is working on that legislation to extend the Vietnam War era to like 75. It cut off, I think, in 1973. But there was a movement been going on for a while to get it extended to 75, because that was, I guess, officially the end time. But it's not in.
May something of 75, yeah.
Yeah. There was a couple of years in there where, people were getting payments, if you were in that qualified time, they were getting payments from the state, but those people weren't able to get those payments. I know Gary Dietrich, one of our VBA members, is working with the legislature on that for quite a while now, so.
And the VA, that's where we get our dates from, was from the VA itself, so May 7th of 75.
Yeah.
They already recognized it out to 75 so far.
Yeah.
But apparently the state doesn't do it, so.
And then the VA will recognize actually from sometime in 1955 to 60-something, if you had boots on the ground. Not that we had people in Vietnam at that time, but if you were there as an advisor in whatever capacity, they'll recognize for wartime service.
Yeah. Any questions about the burial forum? Otherwise, I guess just to receive it, motion would be in order.
Motion to receive it.
Support. Discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. Saturday hours, working extra, eh?
So something else we've noticed, and we've actually had some requests, we have a lot of veterans in the county that are not retired. Obviously, a lot of the people we provide services for is an older clientele, which is great Monday to Friday, but we do have a lot of, Desert Storm and even younger veterans coming in, that it's difficult for them to get to us And so we're going to, hopefully June, we'll launch it. And we've already spoke to the folks across the way at the library, and they're going to provide us a space, like on a Saturday, that'll be a closed off space, and Mark will come over, and it'll give me some opportunity to actually work on claims, since I mainly deal with the emergency relief. And then Mark will be there as kind of an advisor to me. And that way we can start working with folks that just can't make it to us in that 9 to 5 period of time because of work, because of family obligations, et cetera. And we're going to see how that goes. Strictly appointment only at first, and then that will only be open to Bay County residents at first. But if it looks like it's something that is working, we're getting full up of appointments, and we find some reason to expand it, we'll look at expanding it or even moving it around to, like, say, the library in Auburn or the library in Pinconning, or maybe even here just at BVF on a Saturday, but trying to get out to where these folks are at and make sure that they have the same amount of time and opportunity for representation.
Are you trying to do it one Saturday a month or one a quarter?
At first, yes.
One Saturday a month?
Yeah.
Sounds good. Any other questions? Miscellaneous, Mark and Andrew, annual training.
So we had just come back, we're required to do, by the VA, Andrew and I are accredited to the VA to do claims, to file claims for veterans to the VA itself. So we're required annually to do at least 16 hours of training, and generally that only comes in the form of you have to go someplace to go to a conference. So we just came back the end of April from our fall conference up at Shanty Creek. So it was good. I learned a few things. Got to talk to, it's attended by service officers from the 83 counties in the state of Michigan. So you get different experiences from people in the UP who obviously probably don't have the population that we have here or in the southern part of the state, veteran-wise. So you hear things that they're doing, you hear about programs and activities, and it's like, well, that's kind of cool, but there's just no way we just don't have the people to do that. So you hear a lot about things. We also get briefed, like the deputy director from the VA regional office in Detroit she came again this year, kind of talks about what's going on in VA world, since that directly affects most of what we do with claims. And there's actually dependency claims, and changing bank direct deposit information takes forever. It takes actually longer than it does to actually get a claim through VA for them to change your direct deposit or to add your spouse to the claim or a kid. So somebody had asked and said, hey, what's going on? We've got the one just finished today. We submitted back in December, well before Christmas, and they're just now, and they'll back pay, they'll retro pay that back to them. But it's like, why does this take 6 months for you to add a spouse to a claim? When we send you, you have her social, you have the marriage license, you have all the information you could possibly want. And she had explained to us that Detroit is only one of 5 stations. VA has a regional office in all the states, and then Puerto Rico, Guam, Philippines. No. Not Philippines, Guam, and then,
Puerto Rico.
and so work doesn't just stay in Detroit. Detroit isn't our only place that does our work. It goes anywhere within the national work queue, so that any station anywhere can work on our claims. And generally for certain claims like radiation, MST, and other things like that, they have only one station that'll work on that. That's their specialty. So radiation claims are usually done in, I think, Tampa, St. Pete. And then they have other things. But she was explaining that Detroit is one of 5 of their stations that has a team dedicated to them that adds dependents and does all that kind of work. And that is their focus, but that's one of 5 out of 50-some other stations. So even though every day we're submitting changes, it takes them 6 months or longer to actually make the change to the system. So it's very, there's a great deal of information that gets around. The state was there, Michigan Veterans Affairs was there. The director was there. He had come to see us several weeks before that. We saw him again. He'd remembered being up in Bay County. He couldn't remember our names, but remembered being up here. So it's a good, it was good. And then various speakers, various There's what was Susan?
Financial counseling.
Oh, there's a lady in Macomb County who does financial counseling for anybody, any veteran in the state. She'll help anybody, so we've got her information, that if we find we get people who need help with making a budget or figuring out, financial, she will help them, and she's an accredited financial education person. So that's what, and she's done it for 20-some years. So it's good to get out and to see the other people, what's going on, and then our association also has their annual business meeting. And the fall meeting, they meet twice a year. Normally, we don't go to the fall session because it's usually just more informal. We don't get credit for going to it. That's necessary, that we're required to send to VA. It's actually going to be here in Bay City at the Doubletree. So kind of a...
Compensation and pension, I imagine they're still sending those out to outside reviewers or.
Yes,
people
they
that do
still
that.
say, yeah, outside medical, yes.
It takes a while to get that process going.
And that seems to be right now where the slowdown is getting the medical opinions back into VA's hands for them to review it and do,
Yeah.
and to figure out, that seems to be where the slowest part
Yeah.
currently, but they're moving fairly quickly. They've supposedly got the queue under 100,000 claims, I think was what she had said, which I'm considering it, when PACT hit, we were at 600,000. And of course, our joke is always, because it's easy to say, no. Nope, denied. When, it's always the way we're always.
Appeal process.
Yeah, and then we appeal, and actually, I didn't give it to you this time, one of the stats we handed out at the last meeting was that how many more supplemental claims we're doing as opposed to doing original claims to the VA. Because either, especially with the Gulf War folks, they're doing the claim on their own the first time, so we don't always see them in the office. So we come back, they've gotten a denial for something or they don't understand. So we're, filing a supplemental claim or a higher level because VA missed something or that person didn't understand how to relay that information to them. So we're finding we're filing a lot more of the supplemental claims than original claims. So.
Compensation and pension can take a while too if you have to order other testing, if they need a pulmonary function or a hearing test or something like that, you have to send that outside and that's somewhere else. I remember going through the process myself. I had to go to Mount Pleasant for lab work. I went to Saginaw for something. I went to Saginaw for the CNP. So it wasn't all you do in one day. It takes a while to schedule all those things too.
And they don't do them, they used to do them at the Saginaw VA Hospital. The VA hospitals used to be the ones who did the exams. But they found there may have been a little conflict of interest going on between the VA hospitals and the other side of VA going, yeah, we shouldn't do that anymore.
Since they're paying the bills, let's see. We don't have enough money, let's deny this claim.
Even though, we have to assume the two sides of the VA house were being fair and equal.
Yeah. It's a perception of a conflict. Hopefully there wasn't, but there is that perception that if you're paying the bill, you have a conflict that you would try to keep your costs down as much as you could. So that's why they outsourced it.
So, and then we'll be going again in the fall, in August. American Legion has their annual conference. American Legion, we have to work through a veteran service organization as county service officers. We have to send our claims to somebody for them to review them and upload them. Unless you're accredited to our national association, then you can do the work directly yourself. We don't generally do that because it puts a lot more on us than if there's appeals, because then you have to do all the work, you have to spend the 2 hours reviewing the claim, and then you have to talk to the judge, and then you do all the work, so it's easier for us. The veteran service organizations have staff that does all this, who are specially accredited by their organizations and trained every year to handle appeals to judges. So we let them generally do it, and Corporation Counsel here does not want us to do appeals, just to keep us out of trouble as well, so. It's fine. I mean, there's just no way with the amount of veterans that we see in a week, in a day, in a month, that we'd have time to spend 5 hours on one particular person prepping for a case, have the case, and then, continue with everything that goes on after it. So there's just not time with 1.5 staff people. So it's just not a possibility that we could There's about 6,000 veterans in Bay County alone, but we don't just handle Bay County, we get veterans from Saginaw. I'm also accredited to the Veterans of Foreign Wars. They do not currently have a service officer in Saginaw at the VA hospital, so they kind of divide them up. If you're closer to Flint, go to the Flint service officer. If you're closer up here, come to us, or go to, I don't know, Midland's not accredited, and I don't know if Tuscola would have to be the other one, so we kind of get more. And then we get some people from Midland who want to come to see us. We get people from other places who've moved but still want us to help them with their claims. We can do it, so it's not a problem.
Any questions? Are you hosting a tour of your facility if our new members want to take a look?
Oh, certainly, if they want to come down after the meeting, come out and see our space. We have plenty of time for that, so.
Yeah.
It's a great space. We moved down there 6 years ago. We used to be up on the second floor in the corner. It was not really conducive to having private conversations with people about their medical things, that everybody could hear you. So it's much nicer, it's much more quieter. We've got doors that can be closed in the cases where we need to, where people are uncomfortable with everybody hearing their stuff, so.
Any other questions? Stop down for a visit. Announcements, 2026 Memorial Day schedule, I think it was in your packet.
Yep, it's just the schedule of all the ceremonies that are happening on Memorial Day at 9:15 here at the Bay County building at our memorial, right in front of the building if you want to come out. It's real quick, only takes about 15 minutes at the most. And then you can see all the units move around. The various service organizations are the ones who do the ceremonies at the cemeteries or at other.
I count 23. I counted 23
Yeah.
sites or locations now. There's different units that go, the Vietnam vets, well, we have the helicopter memorial, that's at 10:45 at the memorial. The local ones, the big local ones, the Bay County building at 9:15. And Vietnam vets, we have the noon one at Floral Gardens, that's usually a fairly good sized one. And then Veterans Memorial Park along the river, and then the Edson, USS Edson at 1:30. So quite a few.
8:30 in the morning.
You're all invited to attend, that's next Monday.
And like you'll see, 6950 doesn't come into town. 6950 is out between 7 and 8 Mile on Beaver Road. So kind of, they handle all the things that are out that way and take care of everything. They don't generally come into town to handle the events or the services. Even though it says all units at the Oak Ridge, they do not generally come in.
Stop by. And citizens input, last chance. Otherwise, motion to adjourn is always in order.
Motion to adjourn?
Support? Discussion, all those in favor say aye.
Aye.
Opposed, motion carries.